ni watu yake kwa hospitali. We tried, we did not succeed. Strangely, in the last election, universal health coverage was in the Kenya Kwanza manifesto, and it was also in the Azimio manifesto. Unanielewa? So it is something we agree, all of us, that it is something to be done. But nani atafanya ndio kizungumkuti. So that's why this time round, I said, whatever it takes. Niitwe Zakayo, niitwe nani, ni sawa, lakini this thing, we must do it. Mnanielewa, my friends? You know, I can never have a better meeting than this. This is a meeting of intellectuals. Sindio? And that is why I must take time to explain to you, because you understand what I'm saying. So what did we do? We changed the structure of delivery of health, because why we failed in NAC, why we failed in Grand Coalition, why we did not succeed in Jubilee, is because we didn't have a sound legal foundation. Because universal health is not a roll of the mill, it's not a simple thing. It is probably the biggest project a government can undertake, because it involves every citizen. Health is not a sectional issue. Health is a national issue. So we changed the law. From one law of NHIF, we now have 5 pieces of legislation. We have passed 4. There is one now in the works in Parliament. We changed the funding structure. We've changed the delivery structure. And now I can confidently tell you, for the last 1 year, which we have implemented universal health coverage under SHA. It's been difficult, but you are beginning to see the results. SHA is beginning, there was initially, it's not working. And then it came to, it is working, but. So we are moving. Yeah? We are going to remove the buts. And I want to promise you, we are determined. SHA, universal health coverage, must work. Because the Constitution of Kenya, Section 43, says health is a constitutional right of every citizen. It is not a privilege for those who have money or those who can afford. So we're implementing universal health coverage. NHIF had 7 million contributors. SHA now we are at 27 million Kenyans registered. It was a preserve for a few. We are now agreed that, number one, we are changing even the financing structure. The old NHIF, the low cadre of people, you know, wale watu wa chini huko, the lowest was 500 shillings. 500 shillings is for the people whose income is between 3,000 and 5,000 a month. Assuming even it is 5,000. If you tell somebody who is earning 5,000 a month to pay 500, what percentage is that? 10%, right? 500 is 10% of 5,000, sindio? So the poor people, the people at the bottom of the pyramid, we are telling them, pay 10% of your income. And then mimi napata 1.2 million. Hawa wadosi wameketi hapa wanapata 1,100,000, 700,000, 800,000. Sisi ambao ni wadosi hapa, sitaki kusema yenu. Sindio? Sisi tulikuwa tunalipa 1,700. If you do a percentage of 1.2 million, 1,700, it is 0.01%. Sasa, good people, you are intellectuals. The poor are paying 10%. The rich are paying 0.00. Is there any fairness? Is there any logic? Tunaelewana? So what did we decide? We said, let's